Natural solutions for lowering your blood pressure. Hi. Welcome to Life is Good. Check the link of the article at the description. Please share and subscribe for more informative videos. Lowering blood pressure is doable with natural remedies which are usually targeted at the source of the problem and have become far more popular now. We all have known that medicines would just mask the symptoms of the high blood pressure, and not cure the source of the problem. Natural remedies are far more ideal in the society nowadays as they represent the new age cure, while drugs we take have side effects which put additional stress on our health as well. Natural ways can be in many forms, such as relaxation and breathing exercises, healthier diet choices and physical exercises which helps to bring the overall health back to the normal state. There are also remedies made right out of your kitchen. Here are 4 tips that can help with your high blood pressure. 1. Reduce intake of salt and sugar as these can raise the blood pressure. 2. Eat less red meat, instead eat more fresh fruits and vegetables. 3. Exercises are good for our body. Be active in your daily life activities and doing things that require movement than being stagnant. 4. Take products that have a beneficial effect on blood pressure. For example, taking extra virgin olive oil, dark chocolate, green tea, etc. Certain concoctions made right from your kitchen are also known to help. There are many ways diet can help to treat health issues from the inside out. Another useful method is meditation. It is very effective to aid relaxation and relaxes your mind, which in turn helps to relieve stress. These natural remedies definitely treat the underlying cause, and improve your health significantly. People who suffer related diseases such as diabetes and cholesterol also benefited from these remedies. If you suffer from high blood pressure, it is dangerous to leave untreated as it will lead to heart attack or stroke, which is a serious form of a health issue which most of the time is irreversible. Therefore, it is of a serious consideration to address this issue early. There are no disadvantages of having natural remedies to deal with any health issue. This will only strengthen your overall health being. Being healthy is the most important for anyone to enjoy life, without having to restrict oneself from doing anything. Who knows, you will be adding years to your life. The emphasis is on natural solutions. There are no secrets or whatsoever. There are so many people out there who have achieved their goals of being healthy again after following healthy ways of living. I believe you can do it too. There is hardly a limit in what a person can do once he set his mind on. All these ways can help in lowering your blood pressure. You cannot just be taking your medications to lower your blood pressure without doing something to improve your general health. All work hand in hand to aid you for a better health. Hypertension, cause and treatment. Hypertension or high blood pressure does not cause people to have a short temper as some people may think. Actually, hypertension does not have any symptoms. Studies indicate that about 1 in 3 American adults have hypertension, but because there are no symptoms, about 1 in 3 of these people are unaware of it. If it is left untreated, it can lead to heart disease, kidney damage or stroke. These reasons are why hypertension has been labeled as the silent killer. The only way to tell if you have hypertension is to have your blood pressure checked regularly. Although intensive and costly research has been conducted on hypertension, determining the precise cause of hypertension has been elusive. Doctors have been unable to determine the specific cause of hypertension in about 90 to 95% of all cases. This type of hypertension is labeled as primary or essential hypertension. Although the precise cause of primary hypertension has yet to be identified, researchers have been able to find common attributes in people with primary hypertension. Studies indicate that primary hypertension only occurs to people with a daily intake of salt that exceeds 5.8 grams. Heredity and race were proven to be factors in 30% of the cases that were studied. People with a family history of hypertension were twice as likely to get it. And the number of cases of hypertension was greatest among African Americans. Also, most of these test subjects exhibited increased stiffness or resistance of their peripheral arteries. This stiffness has been linked to genetic factors, obesity and lack of exercise, excessive salt intake and old age. About 5 to 10% of the cases of hypertension can be attributed to some specific cause and is called secondary hypertension. Chronic kidney diseases, oral contraceptive pills, adrenal gland tumors, chronic alcohol abuse and coarctation of the aorta are known causes of secondary hypertension. Coarctation of the aorta is the most common cause of secondary hypertension in children. Doctors have not been able to find a cure for primary hypertension, but they have been able to determine treatments that might lower blood pressure to levels that will prevent the complications of hypertension. Secondary hypertension can be managed by treating the underlying cause. If you are a person with mild or moderate hypertension who does not have any damage to the heart or kidneys, you could consider a change in your lifestyle. These changes include maintaining a healthy body weight, lowering the amount of salt you consume, giving up smoking and reducing your consumption of alcohol. Some doctors recommend aerobic exercise for 20 minutes at least 3 to 4 times every week. An eating plan that has been proven to reduce blood pressure is the Dietary Approaches to Stop Hypertension eating plan. This eating plan is from the clinical study, which was paid for by the National Institutes of Health. This diet consists of fruits, vegetables and low-fat dairy foods. This diet is low in cholesterol and fat, and high in calcium, potassium, magnesium and protein. Something else you might consider is a relaxation techniques such as meditation, yoga, biofeedback and hypnosis. People with moderate or severe hypertension will probably have to use one of the numerous drugs that have been developed to treat hypertension. These drugs include beta blockers, diuretics, calcium channel blockers and angiotensin-converting enzyme (ACE) inhibitors. People with heart failure, diabetes, or asthma should use beta blockers with caution. If you have heart failure, kidney disease, or diabetes, then you should use ACE inhibitors. Situations involving more severe hypertension may require a combination of 2 or more of these drugs. These drugs must be taken on a daily basis since they only control and do not cure hypertension. Herbal supplements. Globally, more than 1.5 billion people have hypertension or high blood pressure. It is a chronic medical condition and often called a silent killer since it can cause a lot of damage to the affected before the disorder is identified. Usually when the heart beats, it creates force which gets transferred to the blood. The blood takes the force to the arteries and creates pressure within the arteries which is known as blood pressure. Systolic pressure and diastolic pressure. During each heartbeat the blood pressure varies between a maximum or systolic and a minimum or diastolic pressure. Systolic pressure is the part of the normal cardiac cycle when the heart contracts and blood flows out of the heart, while diastolic pressure is that part of the cycle when the heart relaxes and fills with blood. Blood pressure readings measured via the sphygmomanometer correspond to the systolic pressure and diastolic pressure readings. The abnormal elevation in either or both of these measurements will lead to hypertension. Below 120/80 is the normal value of systolic and diastolic pressures. 139/89 value represents pre-hypertension and 140/90 or above value is considered as high blood pressure. Types and causes of hypertension. There are 2 types of hypertension: primary or essential and secondary. Almost 90 to 95% of those diagnosed with hypertension are affected by primary or essential hypertension. There are various causes for this condition. Individuals who consume excess salt in their diet, specifically more than 5.8 grams a day, are more prone to high BP, obesity, lack of physical activity, aging, genetic propensity. Excessive alcohol indulgence for those sensitive to alcohol. Secondary hypertension is less common and affects only about 5% of the patients. This hypertension develops due to a disorder of any specific organ or blood vessel, hence called secondary hypertension. Secondary hypertension can be caused by endocrine diseases, kidney diseases, specific medication, tumors, and sometimes occurs during pregnancy. Long-term and short-term effects of hypertension. Heart attack and heart failure. When there is excessive pressure, the heart begins to function harder, which increases risk of heart attack. The heart muscles are thickened by the additional pressure, leading to heart failure. Stroke. Any interruption in the flow of blood in the brain will cause stroke. The important parts in the brain get damaged due to disturbance in the blood flow. Stroke also occurs when there is any blockage in the blood vessels. Hypertensive patients are at high risk of stroke and brain hemorrhage. Kidney disease. The primary function of the sensitive filters in the kidney is to regulate the fluid in the body. Hypertension and irregular blood flow can damage sensitive kidney filters. High blood pressure patients are at high risk of developing kidney problems. Eyes. Hypertension can damage the tiny vessels in the eyes, resulting in loss of vision. Hypertension or high blood pressure may lead to bone mass density loss, sexual dysfunction, as well as epistaxis, nosebleed, or uterine bleeding. Lifestyle changes which help in management of hypertension. Diet. Add fish, lean meat, chicken, fruits, nuts, vegetables, legumes and whole grains in diet. Avoid unsaturated fats in your diet. Reduce weight. Reduce the excess weight, since excessive visceral and abdominal fat may worsen hypertension and can also lead to other diseases like diabetes. Salt intake. Maintain a low-salt diet. Use low-sodium salt and restrict your daily salt intake to less than 5.8 grams. Exercise regularly. Exercise will help maintain proper circulation, burn calories and strengthen the heart. Home remedies for managing hypertension. Vitamin C helps in reducing hypertension. A teaspoon of freshly squeezed lemon juice mixed with honey and water is very beneficial for those suffering from hypertension. Amla or Indian gooseberry is very beneficial for high BP. 1 tablespoonful of fresh amla juice mixed with honey and taken every morning is beneficial in managing high BP. Fenugreek seeds can be taken with water in morning and evening on an empty stomach. Fresh papayas, eaten on an empty stomach, can be beneficial. Papayas are rich in carpane, a cardio-supportive enzyme. Herbal supplements for hypertension. Garlic. Listen. Listen or garlic reduces cholesterol accumulation. It helps in normalizing blood pressure and preventing heart disease. Arjuna is an Ayurvedic herb which helps to reduce hypertension, reduces cholesterol and protects and tones the heart. Arjunan, a cardioprotective herbal supplement, improves blood circulation to the heart and helps to strengthen the cardiac muscles. It exerts mild diuretic action and relieves pulmonary congestion. It has antioxidant properties and helps to reduce breathlessness, lowers bad lipids and cholesterol. Cardimap herbal remedy is a combination of Ayurvedic herbs recommended for reducing anxiety, hypertension and insomnia. Sarpaganda herb extract soothes and calms the brain and reduces blood pressure. It is very beneficial for those suffering from hypertension. Jataman C helps to treat hysteria and anxiety, stimulates the brain and improves mental retention. Shankpushpi helps in mental development, and improves brain functioning and concentration. Brahmi is a well-known brain and nervine tonic, useful in enhancing memory and treating anxiety-induced insomnia. Pippa or Pipali is one of the most widely used Ayurvedic herbs. It reduces blood pressure, works as a rejuvenator, enhances longevity, improves digestion and induces sound sleep. Thank you for watching the video. Please share and subscribe for more informative videos. Have a prosperous and wonderful life.